So what I really feel bad for, I know there's, for every person that comes here and gets it fixed, there's probably 50,000 that'll never even think about coming here. They'll either have some crappy dentures like my dad had his whole life, or they'll just do what I do. They'll just suffer and eat what they can. And I can't tell you how much, there's the other thing, you might know, I can't tell you how often I choke. I choke all the freaking time.
Well, that's not good.
And it's choke because I can't chew enough.
Yeah, you can't masticate the food properly.
I chew at the front, my front teeth.
And they're not designed to chew in the front.
Right. And then
you swallow too large of a portion.
Correct. All the time.
Yeah.
I would say on an average of a couple, 3 times a day. I've learned to relax and cough things up.
Yeah.
And that's not a way to live.
So what made you decide to take this next step?
There was a few things we looked at, and it just seemed like the best. I wanted something that could take care of me all at once and make it happen. And then when we came in, we were very happy with what you guys had to tell us.
I grew up with seizures starting from like puberty, and so I used to have a beautiful smile, and then I started having these seizures, and when you have a seizure you bite down really hard, and it was fracturing my teeth. So I started losing pieces of teeth. I would lose the whole tooth itself, and so just a lot of dental problems from that point on, from pain to not being able to smile like when I smile. And I feel insecure about the way that I look, and it's uncomfortable. I'm finally doing it. I'm so excited.
The emotion behind when she first came in, because she was very shy.
Here she's missing teeth in multiple areas, and so we've replaced those missing teeth with dental implants. So we're going to prepare the natural teeth as well as finalize the implants so that her smile and the aesthetics and the bite is restored. So she'll have a beautiful smile, and this will make a tremendous difference for her, a major transformation.
If you live here, you know exactly who he is, and that's who you want to have your teeth done. You want Dr. Willardsen. So I just was so blessed to be able to get in and have his help, and he agreed to take me, and such a godsend.
Hi, I'm David Zimmerman from Trust TV, and I'm here with Dr. John Willardsen of the Trust Implant Institute. Thank you, Doctor, for having us over to speak with you.
Thanks, David. Glad you're here today.
So I heard a story of a horrible case and how you became famous. Could you please tell us about that?
Okay, so a few years back, there was a large implant practice here in Southern California that had generated thousands of patients. And as a result, something happened to where the doctor was taken out of the practice. And so it left all of these patients without a doctor. So the Dental Board of California contacted me to come in to clean up these cases.
I just want to ask you one thing, but why would they contact you if there are tens of thousands of dentists out there?
Well, they were aware of my background and training, and were aware of my experience in implant surgery, implant prosthodontics, and so they did contact me to help in this process and resolve these cases. Because you can imagine, David, if you had spent thousands of dollars on your dental implants, your procedure, yes, and then all of a sudden things are falling apart, and now the doctor's gone. There was a website set up for victims of this implant center. It was in the news. So, and not to dwell on that, but it certainly was the point where I was able to step in and help thousands of patients who were really in a bad way. And it was the type of thing where they weren't so happy that here they had to have this fixed. They thought they were on the path of getting their smile back, restoring their smile, able to eat again. And now all of a sudden they had to have it all redone. So, but as a result, I learned a lot from the process. I was able to kind of really delve into a lot of the procedures that are being done out there. For example, the all-on-4 procedure, which is marketed all over the place. I don't know if you've seen ads for the all-on-4 procedure. And this really was an all-on-4 practice. That was basically what they did. And so I really was able to see a lot of the complications with the procedure, a lot of the failures, and I've completely changed my technique to all-on-6 and using different materials so I don't have the prosthetic failures. For example, what that means is you can have the implants in and then the teeth put in, and then all of a sudden the teeth start falling apart or breaking, or I have pictures of cases where I can show where literally the whole thing just fell apart. But so I'm using different materials that are stronger, that don't break. I use 6 implants rather than 4 implants. The placement of the implants is much more favorable.
And this is the all-on-6?
All-on-6.
So as I understand, the all-on-4 is placing the prosthesis on 4 implants, and all you did was add 2 to the all-6?
That's a great question, David. And it's much more than that. The all-on-4 procedure, yes, it is placing the prosthesis on 4 implants. But in all-on-6, the distribution of implants, it's a biomechanical process. So every time you bite down or I bite down, somebody that has all of their teeth, for example, it's 450 pounds per square inch. So the implant distribution has to be precise. The all-on-4, the reason they do all-on-4 is because they're avoiding certain anatomical areas in the jaws. For example, on the upper jaw, they're trying to avoid the posterior maxillary sinus. It's the sinus in the upper jaw. They avoid the sinus, so they angle those implants at an extreme angle to avoid the sinus. And so with the all-on-4, you're really limited as to distribution of implants. So it throws off the biomechanics of the entire case. And this is what I found with this center that shut down and these thousands of all-on-4 cases. It is that distribution of implants that really caused the failure of their prosthesis, of implants. The extreme angulation on those implants caused bone loss. I saw many cases where the implants were failing, falling out. I had to extract implants. And then we're starting over. And not only starting over, but now I have to graft those ridges, regenerate the bone in order to do all-on-6. This is a typical all-on-4 case. Extreme angled implants to avoid the maxillary sinus, and then 2 implants in the right underneath the nose in the premaxilla, both at an angle, and they're going to use these 4 implants to support 14 teeth, and then have an extension or a cantilever off the backside that really is the equivalent of 3 to 4 teeth.
Right.
And that cantilever is where all the load is, all the pressure is in that area. So all of the force is from about here back to here. And I have an implant here, so I have support. And once I put that implant there, the pain went away for the patient because now there's support. Prior to me placing this implant, every time she bit down, there was a cantilever, like a fulcrum. And so there was pain under her nose. And you can, I mean, you don't have to be a doctor to understand the mechanics of this and how unfavorable it is. And so, again, this is testimony as to why I am not a fan of the all-on-4 technique.
And what's going on with this patient right now?
So now she's pleased, she's happy, she's out of pain, aesthetically she's thrilled, and the fact that we were able to do it so quickly, it really solved a big problem for her because every single time she bit down, she was in extreme pain.
Right.
So the all-on-6 procedure puts the bone where it's necessary so that I have a very nice, even distribution of implants. It's a lot more than just adding 2 implants. I am literally redesigning the entire biomechanics of the entire prosthesis and how it works, the implant placement, the aesthetics, the functionality of it. It's like we're building a house. You need a blueprint, you need a plan before you start you know, you want to know the design, where the light plugs are going, where the walls are going, and that has to be known before you start swinging the hammer. It's exactly the same thing here. In fact, you know, we were talking about the all-on-4, all-on-6, and it kind of goes to the opposite. You know, I have cases where I have a patient that has, you know, 17 implants, and that's, you know, is way too many. And in this case, there is no plan. There's no thought behind, you know, why are these implants going into this position? What is the final outcome or prosthesis, aesthetics, biomechanics, bite, all those things. It's merely just how many implants can we squeeze into this guy's jaw, you know? So David, here is that case that I was talking about where the patient had 17 implants. Right. Notice there's no plan here. They're kind of just randomly placed, and it appears as if the doctor was essentially just kind of putting in as many as he could. I'm not exactly sure why. But now, so this is kind of an overkill of like way too many implants and a real lack of planning. That's the key. And so that comes with, and the only reason I bring this up is because it truly takes planning. So the surgeon placing the implants has to understand the design of the final prosthesis or teeth. They've got to know aesthetically what it's going to look like, functionally how the bite is or the occlusion, and then they've got to know exactly where each implant is going to go. And that's where the all-on-4 kind of falls apart, because they're putting every case, or, you know, at some of these larger all-on-4 centers, you know, the choice is clear. All-on-4 is not for all. It's a procedure and it's okay, but it's not for every patient. Right. In fact, I've had cases where they've gone in and they've signed up for one of these all-on-4 cases, and they've had teeth that did not need to be extracted, and they'll go in and they'll have all their teeth removed that are completely savable, you know. So you really have to do your homework, and if you're having the procedure done, you've got to understand some of these, you know, the risks and the benefits and training of the doctors who's doing the procedure, and not just kind of buy into the advertising and the marketing, because all-on-4 is not for all. It's not for everybody. So it requires somebody that has background in training in both the prosthetics and surgery, so that they all tie together. Because if there's a disconnect between the two, like in this case, the patient, in fact, this patient ended up has 17 implants, and the teeth or the prosthesis they gave him was a denture. It was removable. They had to take it in and out. So he had 17 implants and didn't even have a permanent set of teeth. He probably spent over $100,000 just on, you know, in this process, and ended up with dentures. So that's what we don't want. We want to provide affordable prosthodontics, affordable implant surgery, but done well, you know, done to the ideal, and have outcomes that last for the rest of their life. And that's what our goal is here at Trust Implants. So.
Great, yes. So doctor, I can remember when I went to the dentist to get a wisdom teeth pulled, the trauma that I felt and had to go through. I can imagine these people who need multiple teeth replaced.
Absolutely, David. It is, you know, even just having your wisdom teeth extracted, it's a big deal. And theoretically, if somebody has to have the procedure where they need all of their teeth removed, it too can be a big deal. But because we've streamlined the process here at the Trust Implant Institute, the procedure's done while the patient's asleep. So they go to sleep, we do the procedure, they wake up, and they have a temporary set of teeth that same day. So I've done so many cases that I've streamlined the process. And first of all, I've done a lot of planning. So before I do anything, I've planned their case out perfectly. So I know exactly where each implant is going. I know aesthetically what it's going to look like, and biomechanically where the position of each implant. So yes, in theory, it sounds very, very complicated, but I've developed processes to streamline it so that it really is not that complicated. Right, okay. But I do understand where in somebody's mind they might think, you know, where do I even begin? This is so complicated, because even having a crown was a big deal. But, you know, we really have streamlined the process. So
you can do this process all in one day?
Well, technically, yes. We do the procedure in a day, But there's a lot of ads out there it's a little misleading because they do not get the final set of teeth or final prosthesis in one day. That's not possible. They get a temporary that's attached to teeth or implants in a day, but the final set of teeth comes after a series of appointments to fine-tune everything, because in reality, it takes a lot of customization and fine-tuning to get the final aesthetic result that we want. And we get really close because I do all the planning prior to the surgery, but to really fine-tune it, I need all those implants in the position that they're going to be in, and then I need to make some adjustments to the shape, the color, the size, and that sort of thing. So yeah, the procedure is done in a day. They wake up, they have implants, and they have teeth. But I don't want to mislead people in that it's the temporary set of teeth that they get in a day. It's not the final set of teeth. But the final comes, and in order to customize that, I need a few appointments to do that. But we've streamlined the process to where it's done quickly, even once we get to that final step.
Okay. So when you talk about color, shape, placement, or implant position, this is not a cookie cutter process.
Absolutely not, David. It is very customized. Once I get, and that starts at the beginning. I start customizing and tailoring the ideal situation for every new patient, or every patient that I treat. And so I customize that, and I start from the beginning, and I know where I'm headed so that in the end there's no surprises. But when I get to the end, I'm able to fine-tune and actually apply perfect imperfections so that it's not cookie cutter and every smile doesn't look exactly the same. I mean, in fact, I feel that the All-on-4 is actually very cookie cutter. The placement of the implants on every All-on-4 case is the same. It does not really change. I mean, a millimeter here or there. And that forces the doctor to kind of put the teeth in the same position. So the procedures that I do are much more tailored to the needs of the patient. And we don't just pull teeth that don't need to be pulled in order to provide the patient with 4 implants. We're very customized here so that in the end, the person who comes to me, by the time they get to me, a lot of times they are pretty down and out. They're not smiling anymore. I've literally have cases that are patients who they've stopped even looking for work. They can't eat certain foods at restaurants. I mean, it is truly life-changing. So once I get that person and I'm able to customize and really finish up their case, it's life-changing. And I see patients getting jobs, finding new love in their life, or whatever the case may be. But it truly is a life-changing procedure. And those that need this done, they should really consider.
We talked about the one-day process, and I want to hear about you doing everything under one roof.
Okay, so a lot of the kind of the norm out there is to have one doctor do the surgical aspect or place the implants, and then have another doctor do the restorative or the prosthetic aspect. There are centers out there that do it under one roof, but a lot of times in those centers you'll have one doctor doing the surgical aspect. The patient might see them 1-2 times max, and then never see them again, and then have another doctor doing the restorative. But here at the Trust Implant Institute, it's done under one roof by the same doctor from start to finish. So from the diagnosis to the treatment plan, to the surgical planning, to the surgical execution, and to the prosthetic fabrication. It's all done by the same doctor under one roof. So that's good because there's continuity to the case. The person placing the implants knows what the final result is going to be, so the implants are placed according to the ideal position. So under one roof, it truly allows us to control the case to the point of to completion, and in reality, that's how we get happy patients. That's how we're able to get results. I've been doing this for over 20 years. I was trained at the only university in the country that has an implant-based prosthodontic implant surgery program. And then also helping the dental board through that situation that we talked about. You know, I've compiled all of this information to provide the patient with the most functional, aesthetic, long-term, viable solution possible.
Right.
And also, on a side note, we can do it at an affordable rate. We do a lot of cases, we buy our implants in bulk, so we're getting our materials for a lower cost, and we can pass that savings along to the patient. It's a big commitment for patients that have to undergo this procedure. It's sometimes they're nervous, apprehensive. Our in-house anesthesiologists that's another thing we should probably talk about, is a lot of times the operator or the surgeon placing the implants is providing the anesthesia. It's not uncommon for the doctor doing the surgery. So if you can imagine, I'm doing the surgery, placing the implants, doing the bone grafting, and providing the anesthesia on a large case like this. It's
some do both.
It's not uncommon that the surgeon is the anesthesiologist. I prefer that I have an anesthesiologist to manage that, and then I can concentrate on the surgery. I am licensed to do the anesthesia. I am licensed to do the sedation, but my preference is to have my anesthesiologist handle that. We have an anesthesiologist who provides the entire anesthesia and is there the entire time, of course. We use propofol, remifentanil, fentanyl, Demerol, Versed, and by doing that, by using these medications, the patient wakes up with minimal nausea and really wakes up pretty quick, especially with the remifentanil. It metabolizes quickly. They wake up and they're a little bit groggy, but they're not so out of it like with gases. A lot of times with gases, you get more nausea and vomiting and that sort of thing. But as far as patients are concerned, they don't need to worry. They don't need to be concerned or have anxiety or fear because it's under anesthesia. It allows me to really be effective in surgery so that I can get the case completed and finished in an efficient amount of time. So, we are all about patient safety. We want the patients to be able to come in, feel confident, comfortable, go to sleep, wake up, and have their new teeth done, and not have a lot of nausea and just enjoy it. Yeah.
Great.
So the big question, doctor, everyone's talking about the price of implants. What is the overall cost? What can you do it for?
Okay, there's a few corporate implant centers out there, and I would say the average price, very general, but the average price for an all-on-4 upper and lower is about $50,000. So it's expensive no matter how you slice it. But here, what you get is 6 implants, zirconia prosthesis, and again, I go back to the placement of the implants, the positioning, the distribution of implants, the biomechanics of the case. All of those details we do, and we include everything. With that, it's about $60,000. With financing, that equates to $20 or $25 a month difference in the process. So here at Trust Implants, it is not cheap. However, we do provide the patient with the most economical but highest quality materials. And what does that mean? For one, I have so much experience in this that I've seen a lot of new implant centers coming to the market, and they're putting ads out there for a price that I kind of scratch my head because I think there's no way they can be using zirconia and doing it at this cost. But as a result, as I had mentioned earlier with the dental board, I have seen the effects of these of doctors charging a really low fee but using cheap materials, and then in 3 to 5 years, it's the teeth are breaking off, the prosthesis, the bar is breaking, implants are failing. So that's not anything I want to happen to my patients. And so I provide the patient with the very best cost possible given the quality of materials that I use. So I'm definitely not the cheapest guy in town, but my fees, I would say, are lower if you were to compare apples to apples than anybody out there. Also, if you consider the amount of money that most of these patients, by the time I see them, that they've spent at the dental office with crowns and root canals, bridges, extractions, dentures. You know, they've spent probably $100,000 or more, and now they have nothing. When I put this final prosthesis in their mouth, when their implants are done and we've torqued that last screw down, that's the last time anybody has to touch their mouth. And so I build into their case security that they won't have issues in the future, and if they do, I take care of it. And that's why being under one roof, same doctor, is important, because and we have very, very few complications. If there is ever an issue, we handle it. And so, I mean, it is expensive, but it's worth every penny, because when it's done, and they don't have to spend any more on their mouth. So.
Right, wonderful. So it's an investment.
Absolutely.
Do you have financial terms for people?
Yes, we do. We have payment plans so they can stretch it out over time. And it's an investment that is probably one of the best they could make for themselves. Again, restoring self-esteem, restoring the ability to eat, restoring confidence, restoring aesthetics, their smile, their face lights up in reality when they go through the process. So it's worth every penny. However, again, like I said, once I put the torque on that last screw, that's it. You don't have to touch it anymore. And so my goal, my dedication, is to give the patient the very best prosthesis, design, materials for the most economical cost that's going to last them the rest of their life. And that's what our goal is here at Trust Implants.
Fantastic.
I believe that it messes with, I chew with the front of my gums or teeth, so I don't get the effects of the food, the taste of the food, and because I am weak.
He has 3 beautiful daughters who all have fabulous teeth, and he felt that his teeth were in bad condition. He couldn't smile. Whenever we posed for photographs, he would always keep his mouth closed because he was embarrassed.
So what made you decide to take this next step?
There was a few things we looked at, and it just seemed like the best. I wanted something that could take care of me all at once and make it happen. And then when we came in, we were very happy with what you guys had to tell us.
Okay. Ready to get started?
Yeah.
Nice deep breath, sir. Real deep breath. Big smile for the camera.